Hello, I'm Haider Malik, host of the Mehmi Financial Group podcast. Today's topic is financing remote health services, working capital in northern Canada. When you're operating clinics or mobile teams hundreds of kilometers from the nearest city, whether in Nunavut, Yukon, or the Northwest Territories, logistics, patient billing delays, and seasonal flows put intense pressure on cash. Here's how to layer working capital tools so your remote health services stay funded and focused on care. 1. Receivable secured lines. Structure: pledge approved clinic invoices, Medicare, extended benefit plans, private pay to a lender advancing up to 80% of receivables. Benefit: get cash within 48 hours of billing instead of waiting 30 to 90 days. Use funds for medical supplies, travel charters, or on site accommodations. Tip: pre qualify your largest payers, federal health transfers, territorial health authorities, to speed approvals and maximize advances. 2. Equipment line of credit, ELOC. Structure: use owned assets, portable X-ray units, telemedicine kits, generators as collateral for a revolving facility. Advance rates of 60 to 75% apply. Benefit: draw, repay, and redraw seasonally. Interest accrues only on used balances, preserving cash when your clinic is idle, e.g., the ice road frees up. Tip: negotiate interest-only payments and waive unused line fees to reduce costs during off-peak months. 3. Invoice factoring. Structure: sell your invoices to a factor at an 80-90% advance. They handle collections and remit the balance minus a fee, 1 to 3%. Benefit: convert slow pay billing into immediate working capital, critical when charter schedules for specialists delay revenue. Tip: opt for non-recourse factoring to protect against payer disputes or denied claims in remote jurisdictions. 4. Vendor and supply partner programs. Structure: negotiate extended terms, 60 to 90 days, with pharma and medical supply vendors by leveraging annual volume commitments or territorial service contracts. Benefit: preserve liquidity for critical cold chain shipments and emergency restocking. Tip: secure seasonal discounts for pre-ordering vaccines or consumables before spring thaw increases shipping costs. 5. Government and Indigenous funding. Federal programs. Canada Small Business Financing Program covers working capital loans up to $1 million. The Northern Medical Services Fund offers repayable contributions for remote site upgrades. Territorial grants. Many northern governments subsidize airlifts, telehealth kit deployments, and nurse training stipends. Tip: align your loan or line draws to follow grant approvals. Apply early to match territorial budget cycles and avoid funding gaps. 6. Best practices. 1. Accurate cash flow modeling. Build a 13-week forecast mapping anticipated draw and repayment points against charter schedules, supply orders, and payer cycles. 2. Staggered drawdowns. Schedule draws only when needed for big outlays, fuel cash deliveries, or fly-in clinics, minimizing average outstanding balances. 3. Covenant monitoring. If you use credit lines or loans, track covenant metrics, DSO, advance rate thresholds, weekly, and notify lenders early if you foresee a breach. OMITS's 3 action steps. 1. Audit your needs. List your top remote site costs, air charters, high-cost consumables, seasonal nurse premiums, and map their timing. 2. Value your collateral. Get appraisals on telehealth kits, portable imaging units, and generators to define your ELOC capacity. 3. Solicit proposals. Request term sheets from 2 banks, one factoring firm, and your territorial health authority. Then blend receivables lines, ELOC, factoring, and grant funding to minimize cost and maximize flexibility. By combining receivables facilities, ELOCs, factoring, vendor terms, and government programs, and by rigorously managing draws, you'll build a working capital framework that keeps your remote health services operational, responsive, and financially resilient. I'm Haider Malik. Thanks for listening.